I'm Dr. Italo Subarao. I'm the dean here at William Carey University, College of Osteopathic Medicine. And we're really excited. We're really excited to have you here. Most importantly, we welcome you to our campus. As you look around, you see so much growth afoot. You see such dramatic change. And it's an exciting time, and this time it came from the tornado. We saw 3 years ago, this devastating event, and our campus is transformed. And that's what we are. That's the nature of the type of persons we are here in Hattiesburg. That's the nature of the type of people we are here at Carey. So we are not afraid of challenges, okay? What we have here, though, in front of us is a vaping epidemic, a very significant epidemic. Something that is affecting lots of young teens and those in they're 20 years old. Otherwise, healthy adults are becoming critically ill, okay? That's really unfortunate. We're using these e-cigarettes. We've got an unregulated environment. We've got products that are coming in from China. We've got all sorts of additives and things that are being used, and it's having devastating repercussions. So we're thrilled to have experts here in the state to help us cut through a lot of the noise and to help us share some deep insights as to what we can do as a community and know that we can be empowered here after leaving here. So we're very thankful. I do want to acknowledge a few things. Number one, we have here at Carey a wonderful healthcare footprint. Not only do we have a College of Osteopathic Medicine, but we also have a College of Health Sciences. Our College of Health Sciences is composed of our School of Nursing, School of Physical Therapy, and School of Pharmacy. So it's very exciting times. We have graduate programs in all those areas, and we welcome folks to look at those areas. Regarding the COM, we were established in 2010. And when we came into establishment, we came here because of a promise that we made to Mississippi, that we would help. We would help put in primary care physicians, graduate physicians, that would go into primary care and practice in rural, underserved parts of the state. It gives me great pride, great pleasure to say that in the last 3 years, we have about 78% of our graduates have gone into primary care residency programs, and that's among the highest in the nation. So we're very excited about that. That's our graduates. Also, when you look at the quality of the curriculum and things that we've been doing here, we're starting to see a lot of amazing achievements as well. And that's thanks to some amazing faculty and staff that we have. Our level 1 board passage rates were 98% for the past year and 97% for level 2, respectively. So from our perspective, we're very excited. But what matters most to us is not just primary care, but is population health. We see that as a coin, the heads and the tails. You need to understand how to reach out to your patients. We need to understand how to be compassionate and empathetic. But we must always keep aware of the public health threats that are out there and really start to preach prevention to our communities and to our patients. So that being said, we established an office of graduate medical education and population health. And with that, we've got Dr. Melissa Stevens, who's the director of our Center for Graduate Medical Education and Population Health. And she's a leader here. She's been a champion here. When she took over, she's been really putting in programs looking at tobacco prevention, programs such as Tar Wars that she's doing. And it gives opportunities for our first-year students, our third-year students, to get out to the community and to work in the school systems and to let people know about the dangers of smoking, the dangers of vaping. And as we start getting marijuana, you see legalization across the states, we're going to learn about a lot of dangers associated with marijuana as well. So we're very thankful and we're very appreciative. And Dr. Stevens, she's leading our program here. So without further ado, Dr. Stevens.
We're very, very excited to have you with us. As Dr. Subarao said, we're really very proud of the population health work that we're doing here, not just within our community and across the Pine Belt, but really across the state and now even across the nation. And so we want to thank you for coming. As he said, we've been working really hard on tobacco education and prevention over the last 4 years. We were able to partner with the Mississippi Academy of Family Physicians, who has a grant through the Office of Tobacco Control, and we've been able to, through that grant, take Tar Wars out. We started here very small in Hattiesburg with just a few schools. Over the last 4 years, though, we have grown that now, and we're actually going across the state, all the way from Biloxi up to Corinth, where we'll be going at the end of the month. So we're really, really excited about that. We're literally reaching thousands and thousands of children. But what's even more exciting is that that's just a small drop, because we know all of those children are going home and talking to their parents and their grandparents and other friends and family, and we're really spreading the word that way. The other thing that we were really excited about is because of our Tar Wars work and kind of the publicity that was going along with that, we were asked to be one of 10 schools and other clinic programs in the country to partner with the American Osteopathic Association and the CDC to do research on the Tips for Former Smokers campaign. So we were really excited to partner with our friends at the Forest General Hospital Family Medicine Residency Program, and over the last 10 weeks we've been doing research on that project as one of those 10 groups with the AOA and CDC. So we're really, really excited, and we wanted to take the opportunity today to update all of you on the most recent statistics regarding this acute lung injury that we're seeing along with vaping. So without any further ado, I'm going to introduce our first speaker. Today we have Dr. Paul Meyers, who is the state epidemiologist for Mississippi. Dr. Meyers earned a BS in biology from Millsaps College in Jackson and attended medical school at the University of Mississippi School of Medicine. He then completed an internship in internal medicine. He began his career at the Mississippi State Department of Health in 1993, providing direct patient care at the county health department level and serving as the medical director for the dedicated STD clinic for several years. In 2005, Dr. Meyers moved to the Office of Communicable Diseases, serving in multiple positions including medical director, deputy state epidemiologist, and acting state epidemiologist. In 2016, he was appointed state epidemiologist. Dr. Meyers provides medical direction for the Office of Communicable Diseases, which includes the offices of immunization, STD and HIV, and tuberculosis. He has led responses and investigations around multiple emerging diseases and conditions, including Ebola, Zika, and now vaping-related lung injuries. He has participated or led the response of many other situations of public health significance like Hurricane Katrina and subsequent hurricanes, and he's also been involved in the investigations of many diseases and conditions such as mumps, hepatitis A, and other vaccine-preventable diseases. Dr. Meyers has authored multiple publications and given numerous presentations about epidemiology and public health. And now it's our honor to have him with us today. Dr. Paul Meyers.
Thank you, that was a mouthful. That just means I've been around a long time. So, kind of piggybacking on a couple of health indicators. Y'all all know, or you should know, that in Mississippi, in the United States, we are #1 in what? Who can tell me a positive indicator that we're #1 in? Immunization. Immunization. So we have the highest rate of vaccine completion for kindergartners entering school for the first time. We have the fewest vaccine exemptions, so we're proud of that. So recently, however, we've also just been shown to be #1 in our rate of gonorrhea infections. So we have lots of work. We're also close to the top in syphilis. We're close to the top in chlamydia. We have one of the highest rates, like the 8th highest rate in the United States of new HIV infections. So we still have lots of work, but that's not what we're talking about today. Let's talk about the current outbreak of severe lung disease that we've seen directly associated with vaping. This has been a very fast evolving situation. We're learning more every day, and certainly we know more about what's going on than we did even just a couple of weeks ago. But there's still a whole lot that we don't know. I apologize if the slides are jumbled, but it's because I have to update them so frequently because of sort of the changing situation. This is the most current information from CDC. Right now in the United States, there have been close to 1,300 cases of severe lung disease or lung injury directly associated with vaping. And as you know, there have been 26 deaths. We have one in Mississippi. Y'all knew that? So far, there's been no specific etiology other than vaping associated to give us an indication of what's going on. We haven't identified one single product. We haven't identified one single device. And we'll see that it's kind of all over the map. These are younger folks. Most of them are male. Most of them are under the age of 35. Even more astounding is that 15% are under the age of 18. And in that 18 to 20-year-old age range, another 20%. And most recently, one of the newest deaths that we have reported this last week, not in Mississippi, but in the United States, was in a 17-year-old. So this is very serious, right? Okay, so like we said, all have reported some vaping or e-cigarette use. And I've learned more about vaping in the last few weeks than I ever did before, obviously. Most have reported vaping some THC product. It's important to understand that most of these are illicit THC products that you buy off the internet or from a friend or from the guy down the street, okay? These are not regulated products. Many have reported vaping nicotine-only products, not just THC. We've already talked about, we haven't seen any particular device, but we do have some clues, okay? 76% so far have reported vaping THC products. 32% have said exclusively only THC. 58% have reported nicotine. So what we're mostly seeing is that folks who vape both nicotine products and a lot of times are vaping the illicit products as well. 13% though have reported nicotine only. Now, what we have found in our investigation is, as we've worked through with the cases in Mississippi, as you might expect, there's often some reluctance to admit to vaping illegal THC-containing products. So I think it's important for us to realize that in many of these cases, there have been reports of nicotine only, but we also need to consider that even in those circumstances, there may have been some vaping of THC products. In at least one of our cases, the history was, yeah, I vaped a friend's THC 2 weeks before at a party, but, only did it one time. And so, we know from our personal experience as being healthcare providers how difficult that history is often to obtain. Okay, some of the substances that have been identified in these things. Synthetic cannabinoids. Do y'all remember one of the big synthetic cannabinoids? We had the big spice outbreak several years ago. Do y'all remember that? So spice is a synthetic cannabinoid. CBD and CBD oil, THC, often they have been packaged in things called dank vapes. That's been a common one that has many of the cases have mentioned. So dank vapes is not like going to the grocery store and you buy Cheerios, and if you buy Cheerios in one place and you buy Cheerios in the other place, it's essentially the same product, right? Dank vapes are not any kind of controlled product. People just take whatever and they slap it on some packaging. And if you go to the internet, you can purchase these little bags or this packaging, and it's labeled Scooby Snacks or K2 or dank vapes. And so basically what we're seeing is just a bunch of illicit products. Oftentimes the folks are modifying it as well. You know that certainly there are so many different vaping devices. Some of them have wells that contain the vaping juice, right? Some of them have little cartridges, and you can actually purchase those cartridges that can be filled and then sold with pretty much any product in it. So buyer beware, you never know what you're getting with these things. And again, many of the products and many of the sources that cases across the United States, including the cases that we've seen in Mississippi that have vaped THC-containing products, are just purchasing them off the street. Okay, so how are these folks presented? Well, we talked about that otherwise these are healthy individuals. So these are young folks. They're not the kind of people that you think of who have complications from influenza, who have a lot of long-term underlying chronic medical problems. These are young folks who have no other significant medical history. They're presenting with either gradual but sometimes rapid onset of respiratory symptoms. Most commonly, they're presenting with cough, shortness of breath, chest pain that may develop after a short time of vaping, or it could be more chronic use. What we're actually seeing in our experience is longer-term vaping. These are folks who've been vaping for a long time. Sometimes we're seeing some GI symptoms, nausea, vomiting, diarrhea. In other cases, we've seen fever, we've seen myalgias, just sort of some systemic symptoms, okay? We've even seen a lot of times, and we've seen this in our experience as well, is that the vast majority of the cases are hospitalized. More than 90% of the cases are hospitalized so far. And many have accessed health care more than once before they finally are hospitalized. So there's often a delay in recognition of what's going on, because you may get a chest x-ray that initially, in the early course of the illness, doesn't show a whole lot, but if you were to get a CT, you would see some of the significant findings that I'm going to show you. So, universally, we're seeing pulmonary infiltrates. Usually they're bilateral. Usually they are, when they're present, much more severe than you would expect with just a community-acquired pneumonia or viral pneumonia. We are seeing on CT ground glass opacities, and we have actually seen this, and this has been identified nationally as well. So folks go into the ER with GI complaints, nausea, vomiting, diarrhea, abdominal pain, and they're getting a CT abdomen. But they're actually getting some lower cuts of the lung fields and are actually seeing the infiltrates and the opacities by CT from the CT abdomen. And so we've diagnosed at least one case that way. It's not infectious, right? And that's actually part of the case definition, is that there's no obvious infection. So, we haven't seen, and typically when people are coming in and they're evaluated initially, especially if they're having some of these other symptoms and they're complaining of fever and they have pulmonary infiltrates, they're being treated as infection. But what we've seen is often the folks don't respond to the antibiotics. What they are responding to are steroids in most cases. A lot of them have been extraordinarily ill. 90% hospitalization rate. Many of them are requiring intensive care. Many of them have required intubation and ventilation. But most of them, even when they're that severe, are recovering with steroids. What we don't know, right? What we don't have any ideas of are what are going to be the long-term health effects as a result of this injury that they're sustaining. Okay, so what in the world is in even just if you were to purchase the nicotine based vaping solutions? Okay, so those nicotine cartridges or the solution that you use, are those regulated products? They're not regulated. Now, FDA has the authority to regulate them, but they are not regulated. So there are any number of heavy metals, the flavoring that can lead to some illness. There's been some cancer-causing chemicals that have been identified. And it's not, so when these heat up and it produces this sort of vapor, it's not water vapor. It's whatever is contained within this juice, and a lot of times it is an oil-based juice. So there's really, because of the nicotine, there's no safe vaping, right, for youth, for teens, for pregnant women. Even if they are just vaping nicotine, there's no safe vaping. We know that nicotine can affect the developing brain in young kids and young adults. You know, CDC is now saying that if you're currently vaping, because we are seeing this outbreak of illnesses, and until we know more, consider not vaping. I'm actually saying don't vape at all, because we don't know enough about vaping to really know what the true health effects are. Now, we've had a recognition recently of some acute lung injury that has been directly associated with vaping. But vaping's been around for a while. And because we're seeing this in so many different products, and we're seeing it in some illicit products, we're seeing it in some THC, we're seeing it in some nicotine-only products, we don't know exactly what is leading to these lung injuries. So my recommendation is not to vape at all, period, regardless of your age, and regardless of whether you're vaping THC or you're vaping nicotine-only products. I don't think that there's been adequate studies to determine if there are long-term problems. Certainly we're identifying some acute problems, but I don't even think these acute problems, in my opinion, are new. I think we are just now recognizing the association between these lung injuries and these pneumonias and vaping. So this has likely gone on for quite some time. I don't think that we have some new product or some new bad batch that's leading to this. I think we just have a whole lot left to learn, right? So these are CDC's recommendations. Consider refraining from e-cigarette use or vaping products until, especially those containing THC. Certainly our recommendation is to anybody, if you're currently vaping and you develop any of those symptoms, if you develop a cough, if you develop some chest pain or shortness of breath, see your healthcare provider immediately. Now, that's going to make for some busy times as we move into flu season when everybody's developing a cough, right? But certainly that's our message. Okay? You know, there haven't been adequate studies to show that vaping can be really a tool for quit smoking. I think that there's still a lot of information that needs to be gathered around that. Certainly a lot of people are using it as that, and if folks are currently vaping instead of smoking, we certainly don't want them to stop vaping and start smoking again. Our preference would be that they don't do either one. Okay, this is the epi curve of what we're seeing currently. And again, they've done some retrospective looks in several states. And although we first became aware of the larger problem over the summer and into later summer, several states have looked back and have identified this same syndrome back as early as March. And again, it's likely been going on for quite some time. But you can see as we moved into greater recognition, greater surveillance, greater reporting, we're identifying additional cases. Whether or not this peak will continue to go up or if we'll just level off remains to be seen. But I anticipate that we are going to continue to identify cases, both nationally and in Mississippi, related to vaping. So that's not going away. I anticipate that we're going to have more deaths identified as well. We may have more deaths in Mississippi. I'd rather that we didn't, but we will have more cases in Mississippi, I think. This is where the cases are now. Certainly, this was first recognized in the Midwest, so they've been way ahead of us in identifying cases and reporting them. But we do have cases in Mississippi. Right now, and we'll look at our data, we have 5 cases, but we do have others under investigation. So if I can put the plug in, if as a clinician, you're out there and you identify somebody with a history of vaping and they have pulmonary infiltrates and it is not obviously infectious, it's not viral or bacterial, or it's not due to some other reason, please report those to us. Because the only way we know about what's going on is our reporting system depends on physicians in the community. Y'all are our eyes and ears. And the more reports that we get, the more information we'll be able to collect, and the more we'll be able to say what's going on. So that's where we are now. Every state, and I'm glad it's not Mississippi, but they actually said this on a national call the other day. Every state has identified these cases except for Alaska. I don't know if they vape in Alaska or not, but my suspicion is they do. So this is our experience. We have 5 cases identified so far. We do have 1 death. This was in an individual who was under the age of 30. To me, that's young. Okay. Our age ranges are 27 to 33 years of our cases so far. So that fits with what's being seen nationally, where most of the cases are under the age of 35. 3 of our cases have reported vaping THC, including the death. At least 1 has reported vaping CBD oil as well. 1 case reported vaping THC only, but you can see that most of them have been a mix of THC or nicotine. 2 of them have given us, without a doubt in their mind, the only thing that they have vaped is nicotine products. Okay? And I'll show you a picture of one. So, that is the CT from one of our actual cases. And this was in an individual who was otherwise healthy, no prior medical problems, presented with an acute onset of shortness of breath and cough. They did require hospitalization. And initially, chest x-ray showed a little bit of infiltrates. And the physician who was taking care of the patient started them on antibiotics, did some flu testing, did some other respiratory viral testing. Everything was negative. After a couple of days of not responding, started them on some steroids. But when looked at the CT in comparison to what they were seeing on plain film, they were astounded. And in her experience, she had not seen this level of disease in someone who was young and otherwise healthy. And this is kind of routine for what we're seeing. This is just another review. So y'all can spot the abnormalities, right? And that's not, whoops, that's not normal there. And you can see it a little bit better on the previous one, I think. And the radiologist, and this is not the best view. These are pictures that were texted to me. So these are from, 3 different generations of photographs. But the radiologist did describe those as ground glass opacities, and that's that's been consistent with what we've seen nationally as well. And that is actually one of the products of one of our first cases. And they bought this nicotine-containing product in a gas station somewhere in South Mississippi. And that was the only thing that they reported vaping, was nicotine-containing products. So don't really know what this one contains. We were able to send that off for testing at FDA. So, all right, that's pretty much it. Questions? Yes, sir.
So you mentioned that you see most of the cases are with people who are younger than and whatnot. Do you know what's the average buyer of these vaping products? Is it just that same population, which is why you see that, or?
A lot of it is the same population. So, you know, there's been an increasing number of high schoolers and middle schoolers and young adults over the last several years who are vaping. And you're right, that's where we see most of the vaping is in younger folks. Yes, sir.
Do treatment outcomes to those using steroids, do they appear to be similar between either patients who come in with cannabinoid-based vaping versus nicotine-based vaping or combination?
I don't know that there's enough information to say that yet. I don't think that we've had enough cases and enough reports to really give us a good idea about that. I think that one of the things that we've got to look at, we also need to look at, and one of the new recommendations from CDC now is once you discharge a patient after they clinically return to baseline, that you see them again within 2 weeks. Because of the fact that we have seen folks who've touched the healthcare system and then gone back out and have gotten ill. And it's regrettable, but you know, with our death that we had in Mississippi, this individual accessed an ED and later that same day a primary care clinic, an urgent care clinic, and was assessed, was initially treated for the GI symptoms that they were complaining of, and then given some Zithromax on an outpatient basis, and did relatively okay for a couple of days, was admitted, and then after discharge, several days, died. Yes, sir.
So after treatment, you know, so you show those images with the infiltrates and whatnot. After treatment with the steroids, does all that go away?
It does. It does improve. There has been some improvement. Yes, sir. Yes, ma'am.
Are any of these cases more like cigarette smokers?
Many of them are, and many of them are polysubstance abuse.
And it just
as well.
accelerates the causes of
It may. I don't know that we know enough to say that the vaping on top of cigarette smoking does this as well. Many of our folks have smoked cigarettes. Some of them haven't, right? So I don't know that we know that universally. Yes, ma'am.
Do we know how much vaping, the ones who are getting sick?
Most of these people who are vaping are chronic users, and they're vaping almost daily. You know, we don't know that for sure. From the history that we've been able to obtain, the answer is no, it did not. But we don't know that for sure. And I think that that's part of the concern, is the close follow-up of these individuals who may go back out and continue to vape even after they've been hospitalized.
Dealing with an addictive issue, so it looks like you're going to have to cross over the addictive lanes to help these
It's not a matter of just saying that, no. And, you know, we've got to do a better job of educating the kids. And, you know, yes, sir. Go ahead.
I was just gonna ask, I know that sometimes people use vaping nicotine as an alternative to smoking.
Yeah.
If we're telling them eliminate, you know, vaping, is smoking is the alternative smoking a better dilemma? They're like, well, I don't want to smoke anymore, so I'm vaping instead. And if you're telling them, well, don't vape, you know, it's like saying go cold turkey. So is smoking a better alternative?
Smoking is not a better alternative, not at all. It may just kill you slower,
Call the quit line, nicotine replacement therapy,
right there.
1-800-QUIT NOW. That's the only safe alternative.
I was just curious if your office had a solution to that question.
She does.
There's some cards, there's quit line cards available for anybody who wants to pass them on to friends and family who need to. It's counseling and nicotine replacement therapy, either gum or patches. It's free. It's available to anybody who wants to make a phone call.
Yes, sir.
On one of the previous slides, you had said that only 76% of the vaping actually had THC and only 58% had nicotine. So is there some sort of safer form of vaping that doesn't have one of those chemicals?
So I think that statistic was that all of the cases have reported vaping some compound. 76% of them had vaped at some point prior to the onset of their illness in the 9 months prior, had been vaping THC. And of those, 32% had been vaping THC only. 58%, I guess, had reported vaping some nicotine. But there's a lot of crossover. So most of those folks who are vaping THC are also vaping nicotine. Only 13% said nicotine only. So I don't know that we can say specifically. Yes, sir. You know, we don't have all of that back yet. There's been a combination of things that have been seen nationally. One of the biggest things has been the lipoid pneumonia that's been identified, but that has not been identified in every case. So we may be dealing with more than one thing.
The volume that the people are smoking and vaping is increasing astronomically. From people who do vape, they're using, like, say, for instance, a Juul. One pie would be 1 pack of cigarettes, and they're using 2 and 3. So that's equivalent to a 2 or 3 pack a day habit. So the volume that you're increasing is just, you know, the cancer, you know, that you get from cigarette smoking is terrible in cardiovascular disease, but added this product on, it's just increasing.
It is astounding, and they do estimate, yeah, that one of those pods is like 20 cigarettes or like a pack, and people are going through that. Yeah. Okay. Hey, thank you.
Our next speaker is going to talk just briefly about perspectives on e-cigarette use in the adolescent population. So we have Dr. Richard Calderon, who is originally from Slidell, Louisiana. Dr. Calderon performed his undergraduate studies at Southeastern Louisiana University. He earned a Master of Biomedical Sciences degree from William Carey University, as well as a Master of Public Health degree from the University of Southern Mississippi. Dr. Calderon is a graduate of the inaugural class of the William Carey University's College of Osteopathic Medicine. He completed his residency training in both internal medicine and pediatrics at the University of Mississippi Medical Center. He is currently a faculty member for the Forest General Hospital Family Medicine Residency Program. Dr. Calderon is also a member of the National Health Service Corps. Please help me welcome Dr. Richard Calderon.
Thank you. I've got a little bit of an upper respiratory infection. I'm going to clarify it's not a vaping-related respiratory infection, so I'm sorry if my voice might give out a little bit here. I was told once by a mentor, when you're giving a presentation, you should try to go in between someone who lays a fantastic foundation of what they're going to talk about, and then someone who can answer all the questions after me. So Dr. Steiner will be picking my slack at the end of this. So just to kind of focus on the adolescent aspect of vaping, just to return quickly to what vaping is, these are battery-operated devices or e-cigarettes to heat liquids that produce an aerosol. This is inhaled by the user. So Dr. Meyers talked about a lot of the products of the active ingredients and the inactive ingredients that we know are not safe, such as the heavy metals and the volatile compounds already. But also, there's hacking in these devices. So you can take a refillable single-use cartridge and refill it with anything you'd like. And you can get the same thing purchased on the black market as was talked about. You can also have dripping, which is dropping of the liquid directly onto the device. So this is heating it into a greater concentration than what is typically found in a device or aerosol. And then also dabbing or superheating the substances, again, to contain a higher concentration. So if you hear this terminology, when people talk about vaping, this is kind of hacking the device that's already programmed to deliver the aerosol. So we talked about the acute lung injury being the main focus that's kind of driven our focus on vaping to this point. But specifically for adolescents, there are going to be some long-term consequences of this. The acute lung injury, the median age from the CDC has been about 23. So this is a young person's phenomenon so far, and as we've discussed with our Q&A already, that a lot of this is because these are the typical users of these devices. But in adolescents right now, e-cigarettes or vapes are the most frequently used tobacco product among adolescents. So 2017, there was reported 2.1 million middle and high school students use e-cigarettes. In 2018, the NIH reported that about 1 in every 5 8th graders have already used an e-cigarette, and more than 1 in every 3 12th graders. Speaking anecdotally to some people who have done some local research, it seems to be almost double that in some of our local schools. So this is a very, very common thing. And of course, these are self-reported numbers as well. So we all know that teens might not be as most forthcoming with the use of some of these things. What makes it a little more difficult is if you think traditionally about a kid that was smoking cigarettes in his car or outside and then going back home, there was some kind of evidence of this, right? So there was tobacco smoke smell that stayed with them. There was evidence from their parents about this that might get hinted towards this. And unfortunately, some of this detection and concealment is not as common with vaping or e-cigarettes. So part of this is from the marketing of these devices. They're kind of pushed towards this age group. So if you look at some of these, they look like a USB or a thumb drive. They can just get plugged into the computer to charge and then get used. And if you were an unsuspecting parent, you'd have no idea your kid was using it for that purpose and would just think it was another tool for their education. So there's also ones that have been designed to not leave a big vapor cloud like you would with a regular cigarette, taking a puff and exhaling. You might see little to no vapor cloud. Again, this can be done back in the classroom a lot of times and never noticed by the teachers. Also odorless or near odorless for that same concealment. So we also did talk about as well some of the excessive amounts of nicotine that are in these devices. So again, one pod has been essentially about a pack of cigarettes. And if we think about someone going through multiple pods a day, that is a big smoking habit at a young age under the kind of guise of being safer, which we know now that it's not. In the developing brain that is already at a high risk for addiction, you add on a very, very high dose of an addictive chemical like nicotine, and can really add for long-term consequences which we haven't even seen yet right now. Right now we're really focused on this acute lung injury, but there are going to be consequences down the road because we know that kids that vape and use e-cigarettes are actually more likely to smoke traditional cigarettes. So they've already kind of opened that gateway, and this has been shown time and time again. If you think about just the effects of nicotine itself, especially in these higher doses, you can have high blood pressure, you can have a high heart rate. If you think about the crash that you get after your afternoon coffee wears off, imagine that to be multiplied multiple times in a younger kid who's not used to that crash yet. So you can have inattention as being a big part of this. So we really have to look at this from a multifactorial standpoint of not just being related to the lungs itself, but also the entire patient or teenager in front of us. So focusing on the discussion with your teenagers about this. When you're trying to find out what's going on, just remember that the teenage brain is a little bit different than the adult brain. It's still developing. They're going to be more defensive about things if you come directly at them. So to speak indirectly to your teenager first and start the conversation that way. So ask not, are you vaping? Don't vape, that's not good. Open the conversation with, so kids at school talking about vaping? Is this a thing? Or y'all talking about how people are doing it? Have you thought about doing it? Have you used it? What do you know about vaping? Kind of what's the conversation? Try to get this broader language and open discussion and not just a flat out coming at you, are you using this, you need to stop. And then to use, I don't want to say manipulative techniques, but to talk when you're interviewing, and that's essentially what we're doing as a patient, so interviewing our patients, so when we're talking to our teenagers about the same thing, this health issue, is to, one, find out what they do know about it, and then to kind of, turn the wheel a little bit and say, well, yeah, I mean, I know a lot of kids are using this has been shown, they kind of marketed towards y'all, like they kind of manipulated y'all a little bit with the way they did this, and causing that dissonance between teenagers not wanting to be controlled by a big company, and might just cause enough to say, that's not something I really want to mess with. And just kind of plant that seed in their head that, that they're being manipulated by somebody else and not just interrogated by their parents. So, Dr. Byers did a fantastic job, and we looked at a lot of the same resources for our statistics, so I don't have a whole lot more to add, but I do want to leave some big parting thoughts about this. So, for physicians and other clinicians, don't be afraid to reach out to your state health department with these cases when they're suspected. There's a lot of subspecialists that can help you in this category. So we have great toxicologists, we have pulmonologists, critical care doctors that can give assistance, and the Department of Health certainly can be a unique resource for you. The CDC has great information out there if you want to read up in advance of these patients. For parents and teens, so vaping is not a safe alternative to traditional smoking. When you're discussing this with your teenagers, remember to keep an open dialogue. It's recommended by multiple organizations, the CDC, other medical leaders, that you do not use these products until this investigation of the acute lung injury is complete. And we've had even further recommendations just to avoid it altogether in everyone. Another aspect is just the maintenance of these devices. So if you think about these high concentration nicotine pods that are often colorful and brightly advertised, these can be attractive to toddlers, so please keep these away from any kids that can ingest them orally. And if they do get ingested, to call your poison control center. You can call the national hotline, 1-800-222-1222, and that will directly to your local poison control center to discuss it. And then last but not least, get your flu shot. So last year's flu season, approximately 48.8 million illnesses, 79,400 deaths, and then don't smoke. So cigarette smoking, approximately 480,000 deaths in the U.S. last year. There are evidence-based smoking cessation tools, so please see your physician or other healthcare provider, and don't vape either. Thank you.
For our final speaker this afternoon, who's going to discuss some perspectives on e-cigarette use in the adult population, we have Dr. Stephen Stogner. Dr. Stogner is a native of Tylertown, Mississippi. He's a pulmonary medicine and critical care medicine physician with the Hattiesburg Clinic. He serves as Vice President of the Hattiesburg Clinic Board of Directors and Medical Director of the Forest General Hospital Critical Care Unit. He's a Fellow of the American College of Chest Physicians, as well as a member of the American Medical Association, the Mississippi State Medical Association, the Mississippi Thoracic Society, and the South Mississippi Medical Society. Would you all please help me welcome Dr. Stogner.
Two tough acts to follow, so I don't really have anything to say. Just joking. Vaping is on a surge, as you already know, before you came to this meeting, and certainly now that you've been here. And it's getting people's attention, which has already been mentioned here, because of these young, healthy people, as I look out there, who have no obvious underlying medical conditions that can become critically ill. We have seen for quite some time the various things that people will take into their bodies. That's another issue as to why they're doing it. But you know, everything from the synthetic marijuanas, the spice, some of the most difficult cases you'll ever see in the intensive care unit is related to these various chemicals. And you can't test for them. You can't explain it, okay? So as far as the vaping is concerned specifically, and I'm just going to reiterate that it is soaring in its use. We're seeing it in young people. And from a clinical standpoint, what is being seen is sometimes very difficult, as Dr. Byers has pointed out, because it looks like other things that you see. An acute pneumonia, when it gets to that point, just an acute pneumonia, a viral pneumonia, the influenza, okay? There's no doubt, and as they continue to follow this, that we have probably seen cases of vaping-related lung injury and thought it was something else, okay, when it's actually due to the e-cigarettes, right? You've already heard about the various chemicals, et cetera, that are in these compounds. Obviously, a lot of people have used it for getting off cigarettes, hence your question up there. One of the big differences, obviously, with the smoking is, that's been pointed out, that, you know, this is, with the vaping, you can get an acute illness real quickly. That's generally not the case with smoking. But as I tell some people, if you're going to do something wrong, you need to choose something else, okay? Choose what you're going to do wrong, but vaping is not it if you're trying to get off cigarettes. Many years ago, even as in private practice in pulmonary, we encouraged people to use e-cigarettes. But now they also used to encourage smoking. In World War II, they passed out cigarettes. Here's your pack of, you know, here's a pack of Marlboros. Okay, so you do learn over time. Medicine's always changing. But these substances, which you can certainly consider toxins, you've heard it mentioned about the metals, but you don't know what's in these things, okay? Because people, as they said here, can add to them. Many of them acutely toxic. Hydrogen cyanide, okay, has been found in these things. Various types of compounds, all right? Many of them are carcinogens, cause cancer, known to cause cancer in humans. So certainly we have the acute lung injury issue that we'll talk a little bit more about, but the chronic lung injury, we still don't know what all you're going to see. Asthma-like syndromes, chronic bronchitis, some of these substances are known in the labs to cause endothelial injury, the blood vessels. Okay, so this is not a safe product, all right? And someone who has these reactions that keeps going back to the same dealer, they at least need to get them a new dealer, right? That's a joke. You know, it's Friday evening, sleepy, I understand. But the acute lung injury that is seen in this situation, like I say, looks like a pneumonia many times. When it gets to that point, a lot of times it just looks like a respiratory illness. So you have to have your antenna up. But an acute eosinophilic pneumonia, where eosinophils actually infiltrate the lung tissues. There are different types of that, but that is one of the things that has been pointed out, as can be if you inhale other toxins, it can cause this, other types of drugs, okay? But these substances can cause an acute eosinophilic pneumonia, which indeed will respond to steroids, as Dr. Byers had pointed out. The chronic situation, as I stated, is unknown. This needs to be studied. Repetitive pulmonary function tests, we need studies on a go-forward basis to see what the actual consequences of them are. But let me just tell you, this is not something, and it's all of a sudden blown up, it seems, but this is not something that we just need to fiddle around with, okay? This is a significant healthcare issue, and it's happening to our healthiest, our youngest people. you know, old codgers like me, you know, go get you a vaping cigarette, right? No. But we have to understand that these are people that are just starting out in life. And the issues of why they're using this is often not, in other words, it just doesn't make sense. But it's not a safe alternative. It's a very unhealthy, in the least bit, from the nicotine alone, just ongoing nicotine consumption. And by the way, we talked about these ingredients. Listen, they have actually looked at these various, you know, I noticed that up there a while ago, a slide that said it had 35 milligrams. They've actually tested a lot of these little e-cigarettes. And very commonly, the amount of nicotine in it is not what it's advertised to be, okay? The substances that are found, you suppose we're just going to get you a nicotine e-cigarette and it will have other things in it. Commonly, for instance, propylene glycol is in it. And while that's found in a number of things that you consume, it is being recognized as a potentially toxic substance. They have even found these e-cigarettes that had ethylene glycol in it, okay? Antifreeze, all right, that had it in it. So I don't know what we're going to pick up on the side of the road and inhale in the future, okay? It just seems that if you ain't supposed to have it, that's what I'm going to suck on and inhale into my lungs, all right? But, so I'm going to close it up because we're running a little behind time. But let me just say this. These acute lung injuries are real. Have your antenna up, looking for them. And absolutely be in other words, including not only your smoking history, but the vaping history, especially in certain populations with these things. And I'll be glad to entertain any questions if y'all have any. I think I said all I was going to say. That's it. Thank you very much.
Well, that concludes our summit for today. I want to really thank everybody for coming out, especially late on Friday afternoon. I hope you all learned something new today. And that's really the reason we did this. We want to get as much information out, not just to healthcare providers, but also to the public, and really do what we can to prevent some of this. So thank you so much for coming.